On Emerging Threats and Spending Oversight organized, first I'm going to just gavel us in and say we came to order. But the Subcommittee on Emerging Threats and Spending Oversight organized today's hearing to discuss the Government Accountability Office's 2022 annual report on duplication, fragmentation, and overlap in federal programs so that we may identify opportunities to save taxpayer dollars and improve services by increasing government efficiency. Government Accountability Office, or GAO, Controller General Gene Dodaro joins us today. We are also joined by several GAO subject matter experts who contributed to this year's report. Their testimony will provide the subcommittee with greater understanding of the challenges agencies face, as well as the recommendations that GAO has for addressing those challenges. 12 years ago, Congress tasked GAO with producing an annual report on federal programs that have duplicative goals and that, as a result, may lead to wasteful spending. Since the first report was published in 2011, this annual report has led to $531 billion in cost savings and other financial benefits. And the GAO estimates that at least another $21 billion in financial benefits could be achieved if agencies and Congress follow the GAO recommendations laid out in the reports. Congress and executive agencies' actions to address the nearly 1,300 recommendations made in these annual reports have not only saved taxpayer dollars, but also have improved agency performance and resource management and led to better delivery of services to the American people. I remain firmly committed to ensuring that Congress does its part to eliminate duplication, overlap, and fragmentation to achieve cost savings for taxpayers and improve program outcomes. I was proud to once again partner with Ranking Member Paul last year to reintroduce the Bipartisan Acting on the Annual Duplication Report Act, which directly responds to GAO's recommendations for congressional action called for in the 2019, 2020, and 2021 annual duplication reports. And I'll continue to work with my congressional colleagues to pass these common sense proposals. Once again, I want to thank you, Mr. Dodaro, and to your team for testifying today and for the ongoing work that you and your team does. I look forward to today's discussion on how Congress and federal agencies can work to be better stewards of taxpayer dollars. And as you know, it is the practice of the Homeland Security and Governmental Affairs Committee to swear in witnesses. So, Mr. Dodaro, if you will please stand and raise your right hand. Do you swear that the testimony you give before this subcommittee will be the truth, the whole truth, and nothing but the truth, so help you God? I do. Thank you. Please be seated. The subcommittee is once again joined by Controller General Gene Dodaro. Mr. Dodaro's career at GAO began more than 45 years ago, and he has spent the last 11 years leading the agency. In this position, he oversees the work that leads to the hundreds of reports, testimonies, and recommendations that GAO issues each year. He is widely considered one of the government's foremost experts on government administration, efficiency, and effectiveness, and he has testified before this committee and Congress countless times. Mr. Dodaro today is assisted by GAO analysts who assisted with compiling this year's report. Welcome, Mr. Dodaro. You are recognized for your opening statement.
Thank you very much, Chair Hassan. Good afternoon to you, Senator Johnson. Good afternoon. I'm very pleased to be here today to discuss our 12th annual report on ways to enhance government efficiency and effectiveness. As was mentioned in your opening statement, Madam Chair, the past 11 reports that we've issued, annual reports on this, had about 1,300 recommendations. Congress has either fully, and the administration have either fully or partially implemented 74% of those recommendations. And they've led to the cited savings that you pointed out, which include $535 billion that's already been saved, another $21 billion that will be saved in the coming years based upon the already implemented recommendations. Now, we think there are tens of billions of additional dollars that could be saved in implementing the recommendations that were either partially or not at all addressed in our previous 11 reports. And then again this year, we have 94 new actions that we identified that could also lead to additional savings and improvements in our government efficiency and effectiveness. And again, this year, as our prior 11 reports have done, these cover the various spectrum of the federal government's activities. For example, the Department of Energy could pursue less expensive options for disposing of low-level hazardous and nuclear waste, thereby saving tens of billions of dollars potentially. We also found that federal contracting leaders could employ a use of metrics that we found that a cross-section of private sector entities use to drive down costs and improve the performance of their procurement opportunities. This would give an additional billions of dollars in savings. Also, the government could encourage better staffing at skilled nursing facilities, thereby preventing very costly hospital readmissions or emergency room visits within 30 days of somebody entering a skilled nursing facility, thereby the government paying extra on top of the daily rate for that facility. There are opportunities for IRS to focus more attention on eliminating what has been a growing amount of interest paid on tax refunds for various reasons. Also, there are opportunities to reduce overpayments in the Ticket to Work program at the Social Security Administration for disability benefits. This is a program that's set up to help people get back to work, but if they don't make timely changes to the process, they're overpaying these people, allowing them to keep their work benefits as well as receiving disability benefits. There's also opportunities at the Defense Department to reduce costs for feeding the military through food service, changes that could be put in place, as well as travel reimbursements. Millions of dollars could be saved there as well. We also have called on Congress to designate a federal agency to be the lead and develop a national strategy for diet-related chronic health conditions. Currently, there are over 200 federal efforts at 21 federal agencies. There's not a coordinated national strategy. This has a lot of consequences, both for the health of the American people, the longevity of people living, as well as additional costs borne by our already burdened healthcare system. So we think this would be a good recommendation as well. I thank you very much for the opportunity to be here today and to discuss our work, and I appreciate very much Senator Hassan, your and Senator Paul's introduction of legislation to support our recommendations, and I very much thank you for that effort and look forward to continuing to work with this committee. I've testified on these issues before Senator Johnson as well, and I appreciate the Congress's, particularly this committee's, continued interest. Thank you very much.
Well, thank you very much, Mr. Dodaro. I'm going to start with a round of questions, and then it looks like the next person up will be Senator Johnson. Mr. Dodaro, to date, GAO has made 121 recommendations on actions that Congress could take to address the wasteful spending and inefficient operations listed in the annual duplication report. There are currently 59 open recommendations. How should Congress prioritize which recommendations to address? Are there particular recommendations that you think we should focus on first?
I absolutely think those recommendations that have significant dollar savings potential ought to be among the top priorities.
Right.
I issued a report last month that I've repeatedly warned Congress that the federal government's on an unsustainable long-term fiscal path. The more actions Congress could take to reduce federal spending, the more that situation will help be resolved over time. There's also very important sets of recommendations that go to improving the public health and safety, and I'd also give those high priority as well. The recommendations we've made, for example, in this year's report about dealing with what's becoming, you know, we have about 50 million gallons of hazardous waste that we haven't got rid of, and our costs are going up every year. I mentioned the healthcare recommendations we have. There's the recommendations we have on biodefense strategies this year, very important recommendations on the pandemic. So my view, Senator, would be where it saves a lot of money and where it has a direct impact on public health and safety, those ought to be the top priorities.
Thank you. There are 8 new recommendations across 5 issue areas for Congress in this year's report. One involves allowing the Department of Energy to run a pilot program to examine alternative ways to dispose of nuclear waste. Why is congressional action needed here? How would congressional action on this particular issue prevent further wasteful spending and inefficiencies?
This deals with one of the biggest nuclear waste sites in Hanford, Washington. The government and the state of Washington have already agreed on how to dispose of the high-level waste, which they're going to vitrify, which is, you know, enclosing it in glass. Yeah. But there's 40% of the waste, supplemental low-level waste, that has not yet been decided how to dispose of. The Department of Energy right now, with our encouragement, is testing using a grouting process which would be far less expensive than the vitrification approach, and then transporting that waste to a location in Texas that's already licensed outside of the state of Washington. There's still some disputes between Energy and the state of Washington that could potentially take this pilot test into litigation that would slow it down for years. And we're concerned that this is only dealing with a couple thousand gallons of waste. And so Congress, by clarifying that this is an approved project for that to go forward with, would give Energy the option. If they could use grouting instead of vitrification, they would be able to do this a lot faster and a lot less costly, thereby both saving money and protecting public health and safety.
Thank you. This year's duplication report also notes that 200 federal programs across 21 agencies exist to combat diet-related chronic health conditions. GAO recommends that Congress assign a single federal entity to coordinate these programs and develop a national strategy to reduce inconsistencies in policies and better manage resources for helping Americans struggling with these conditions. So 200 overlapping programs do not pop up overnight. Different perspectives and programs may be helpful in some cases, but it's hard to believe that having that many programs is the best approach to addressing these issues. How did we get to this point? How can Congress or agencies prevent this kind of situation going forward?
Well, first, this situation was similar to what we've reported on our prior reports. For example, we found 150 STEM programs across many different agencies, a lot of education and training programs. So they develop incrementally over time. Programs are never looked at to make sure they're working effectively, so that if there's a perceived need, there's always the creation of a new program rather than making the current program work effectively. So it has that similar pattern to it that we've seen in the past. Now, Congress took action. We've reduced the number of STEM programs, the number of educational working programs. I think something similar here could be done, but we need a strategy and need input from the agencies. Now, legislation that you've introduced and Senator Paul have introduced requiring the agencies to focus more on identifying overlap and duplication programs. There's really not a process in the executive branch to do what we're doing at GAO, and it should be done. Now, a complicating factor here, as Senator Langford knows, there's not a ready program inventory yet, so people could look across the government and identify these programs. We spent an incredible amount of time and effort to dig this information out across the government. There's efforts being made to develop such an inventory, but your legislative proposals would require each agency using OMB's guidance to identify these overlapping programs. OMB is really in the proper perspective, looking across government to help deal with this issue across agencies. And then Senator Paul has a legislative proposal that would require GAO to look at new programs to see if the work that we've already done would indicate that those programs may be duplicative of existing programs.
Well, thank you for that. Yeah, I've introduced a bill with Senator Braun that would require agencies to identify duplicative or unnecessary programs and work with Congress to eliminate them. And I take it from your comments just now, you think that OMB might be the right kind of point of nexus, for instance, for these 21 agencies who are operating the programs that you highlight, the 200 programs to combat diet-related chronic disease, might be a good convener of a process.
Yeah, it has to be OMB because the agencies have limited visibility on what's going on across the government without the program inventory. They also have parochial interest to protect, and so you need a neutral arbiter to help identify and eliminate some of these programs. OMB could play that role, but quite frankly, they don't really have the bandwidth and the resources necessary to deal with all these issues. So designating a lead agency to do this with support and oversight from OMB would be the way to go, in my opinion.
Okay, thank you very much. Senator Johnson, you're recognized.
Gene, welcome back. Another good piece of work here. This really does show that a really well-crafted amendment. This was done before I came here, but James' predecessor, Dr. Coburn, passed this requiring this duplication report, and it's saved the taxpayer more than $500 billion. It's a real tribute to him and to you for implementing this well. I think we should be honest. I mean, why do we have so much duplication? Well, it's because Congress passes way too many laws, and we don't exercise enough care. Again, you can have this, listing of different programs. I mean, that would obviously be helpful, but there ought to be some type of bird bath, that before you actually pass a piece of legislation or bring it to the floor of the Senate, that it's got to be compared against, what already exists and whether it's going to be duplicating things. It'd be far easier to do it in the front end than trying to do it on the back end. But let's talk about what you've done addressing this on the back end. It's interesting that you've said 74% of what you've highlighted over these 11, is it 12 years now, 11 years?
Yeah. Yeah.
Have been implemented fully or partially. So what I want to do is just kind of go the $500 billion plus. Give us the best examples. I mean, how has that been implemented?
Right.
Again, I appreciate the fact we're passing legislation, which is what I always try to do is make recommendations, come up with a piece of legislation, but that doesn't always pass. I mean,
right.
How are the different ways, almost fighting a guerrilla war here, trying to pare back government, what has been the most effective ways and the number of different ways that you've seen your recommendations actually being implemented?
Yeah, the biggest dollar savings have come from Congress taking action or not taking action. In the case of, we found duplication between the renewable fuel standard and the ethanol tax credit. And Congress let the ethanol tax credit expire. And that saved at least $6–7 billion. There was a program that was supposed to be a temporary program, and some of these things start out as temporary programs for direct payments to farmers that duplicated a lot of other farm programs. So Congress let that program expire, and that was, maybe $40 billion
So
in his case.
with having every piece of legislation have a sunset clause is kind of a good mechanism for
You need a triggering
eliminating
event.
future duplication.
Yeah, you need a triggering event, and you need to change the incentives. Right now, there's it's incumbent on people like me or others to try to stop a program activity as opposed to the program having to prove they have been effective, they have empirical evidence to show they're effective, and they're deserving of additional funding. So if you had a sunset provision coupled with the burden on the agencies to show that the programs are really effective, then you have a window of opportunity to revisit these programs on a regular, recurring basis, and I think that would be helpful.
But I think it's interesting that the first thing you mentioned that's been most effective is for Congress not to act. I think that's interesting. So where Congress has acted or where an agency has acted, give me some good examples of how action actually resulted in reduction of duplication.
Yeah. For example, we find, this is an agency action, we find in the Medicaid program that they're allowed, HHS, CMS is allowed to approve demonstrations, but the demonstrations are supposed to be budget neutral. We found that the demonstrations weren't budget neutral, and so it was costing more money. It wasn't proving to improve program delivery in the Medicaid services. So we encouraged the department, and they have done, as these demonstrations have come up for renewal, not them to allow to carry over money from year to year. That saved probably in the neighborhood of $150 billion right there. Also, we recommended that DOD use best practices for weapons systems development, you know, have business cases up front, require technology be matured before you go into production. That has slowed down the cost growth in the weapons systems area by well over $100 billion. So those are a couple of the big ones that we've identified.
Again, those are agencies acting. I mean,
Right.
has Congress actually done something good? I mean, have we been able to pass legislation
Yes,
through
yeah.
either appropriation bills or that's
Yeah.
what I'm trying to figure out what has been
Yeah.
affected when we actually acted?
Yeah, there's, like, for example, we identified once with the military services, we're all developing different combat uniforms. And as opposed to having a uniform set, Congress acted and required the agencies to implement, you know, an approach to developing the new uniforms that would be consistent across DOD.
That'd be through the NDAA then?
And, you know, pardon me?
Was that through the NDAA?
I believe it's either through NDAA or through the appropriations. I'm
Okay.
not sure. I can call it one of the two.
That's fine.
Yeah. And then Congress passed the Weapons Systems Acquisition Reform in 2009 and implemented a lot of our recommendations, and so those have been implemented as well. So Congress has passed a lot of legislative changes that's improved things. They've reinforced in the IT area, for example, the FATARA legislation that passed, Federal Acquisition Technology Reform Act, that you know, emphasized consolidating data centers, which was one of our recommendations. That saved about $6 billion right there. So Congress, I said acting or not acting.
Okay. So my last question, what is the most frustrating example that it's just a piece of low-hanging fruit out there that that should be taken care of, that we should eliminate the duplication that you just have not been able to enact?
One is in the Medicare area. Like if somebody goes in to a doctor's office for an evaluation of a condition, and if you go into an office that's located, affiliated with a hospital, versus going into somebody that's in a private building, facility, a doctor is in that facility, you get reimbursed. Medicare reimburses you more for the same service just because it's in a different location. They get more money. To me, that doesn't make sense. There's also...
And that would cost how much to eliminate that or change that?
Well,
Or what would it save?
it would save billions of dollars, yeah. And there's other ones in the Medicare area where they're not adjusting the Medicare Advantage benefits based upon the most recent beneficiary data and characteristics such as race and sex. As a result of that, you know, again, billions of dollars are being reimbursed in the area. The healthcare area has areas that could be a lot of savings.
Thank you for your work. This is, again, a really good guidepost for legislative action, so thank you for what you've done.
Thank you, Senator.
Thank you. Senator Lankford.
Thank you very much. Thanks for allowing me to be a guest on this committee, or the subcommittee today as well, to be able to join in on the conversation. Gene, it's good to see you again. Thanks for the work. Thanks for your whole team and the work they continue to be able to do, to be able to drive some things home. I really appreciate that. It may surprise you that I'm going to ask first about taxpayers' right to know. I know it'll be shocking to you for me to be able to bring this up. This is an area that you and I have worked on for years, trying to be able to get to a point that we can discover what's happening and where we have duplication in government. Your team spends months working on things we should be able to pull up in seconds online, and we're working towards that. OMB had some small pilots back in 2019, 2020 on that. They've now tried to be able to advance on it. So I've got a couple of questions. Are you tracking week to week, month to month on the progress being made on taxpayers' right to know implementation? Are they on track to be able to make it by 2027?
We are tracking it. In fact, our team has a meeting with OMB again tomorrow. We're meeting on a regular basis with them. Whether they're on track or not yet, I think that's an open question. They have these 4 additional demonstration pilots that they're planning to do, as you know.
Right.
Their target is to finish those by 2025, but contingent upon getting enough resources. Now that, whether they get the resources they believe they need or not, I think is the biggest open question.
My understanding is they're looking at some of the pilot programs, talking somewhere around $20 million to be able to run a pilot program for 4 of them. Am I remember that number correctly?
I'm not sure so.
Seems like a big number to me to be able to run a pilot program.
Well, I've also encouraged them to go to the agencies to get help in this area through the various councils that are in place. And they tap the executive branch agencies often to provide support and resources to help run these pilot kind of programs. So, but I think that's the real key issue that I'm keeping an eye on, is whether or not they're either getting the resources directly or getting them from the agencies. And after a while, if I don't see that on track, I will definitely let you know.
Okay. Thank you. I think it's just extremely important. We're never going to be able to get on top of inefficiencies and duplication if you can't see it. So this allows us the opportunity to be able to see it, know if it's being evaluated, know the personnel that's being committed to it, and whether it's helpful or not. This is not about just slashing programs. This is discovering if we have 150 STEM programs, oh, look, we have 150 STEM programs. Then we couldn't see it before, so let's try to figure out what's actually working, what's not working with it. So appreciate that very much. On that same line, you had some recommendations on trade-based money laundering as well, and found some duplication and fragmentation in that area. It brings up to me an issue that I've been poking around on a little bit on it, and it's the lines of authority in federal law enforcement. We have FBI, we have DEA, we have ATF, we have Homeland Security investigators, we have Treasury that's actually doing investigations. Almost all of, in fact, all of those deal with cyber crimes, for instance, plus we have CISA that actually engaged with as well. Have you all been able to do a recent study on overlap on federal law enforcement, how we're maintaining silos and cooperation there, or where we actually have authorities in some places where we may have 4 different branches of federal law enforcement have authority there?
Yeah. The latest work we did was in 2020. We looked at the Secret Service and their activities versus others. Interestingly, what we found, we talked to 12 prosecutors. And from a prosecutorial stand of view, their view, all 12, said that they thought it was beneficial to have more than one agency involved and have jurisdiction because they bring different skills to the process. Now, 2 of the 12 said there are some negatives and inefficiencies, and sometimes multiple agencies are investigating the same entity without either one of them knowing about it.
Right.
So, but we haven't done a broad-based work for a while. I'd be happy to talk to you about doing some additional work. This has been an issue. I've been in government a long time. This has been an issue for a long period of time. Now, in fairness to the agency, sometimes they will have task forces, like there's an organized drug task force at the Justice Department. There's some other task forces where they bring together all the skills, and it's done very well and effectively. The pandemic was another case where they've done that. So if it's done well, it can be advantageous. If it's not done well, it can be wasteful and duplicative.
There are moments when there's a crime scene that has federal nexus on it, and you have 4 or 5 different agencies all show up. Yeah. And you've just got this overwhelming number of people trying to be able to figure out who's going to do the investigation, how it's going to work. And I've not seen a lot of places. There are a lot of places where there's bad relationships there. My interest is, do they all need to be there? Are there tasks that they're each doing? Why do we have 4 of them to be able to do that in that situation? And what's the best way to be able to do it? Who needs to have that clear line of authority so we don't have so much duplication in the process? Yeah,
we'd be happy to look at that issue.
That'd be helpful. Same issue you've dealt with before on dealing with the border, and you dealt with last year looking at DOD assets being used at our southern border for assistance there. My understanding is there are still 7 recommendations that are open dealing with DOD, but that seems to be accelerating. We had U.S. Marshals that were down at our border last week actually trying to be able to help in some of the chaos there at the border to be extra manpower. Have you looked at all this manpower usage from multiple different agencies in their delivery to the border?
Not to my knowledge. No, nothing recently.
It's just an issue trying to be able to determine, best use of resources, what that actually looks like. There's now contract workers that are coming on board as well at our southern border, trying to be able to help facilitate our Border Patrol. It's no grand secret. The drug dealers all know it, but our Border Patrol is so overrun that they've stopped doing checkpoints. They've stopped doing a lot of the interdiction for drugs along the border and in between the border points of entry because they just have the manpower because they're checking in so many people that are crossing the border illegally. So I understand why DHS is trying to bring in additional assets, but trying to be able to determine what's the best use of those dollars and of people and of resources and how we're facilitating the decrease of drugs coming across our border as well and do that interdiction. I think it'd be extremely important.
Okay. We'll be happy to work with you on that issue, too.
Be great. We'll get a chance to be able to talk about it long term.
Sure.
Madam Chairman, thank you very much.
You're very welcome, Senator, and I look forward to continuing to work with you on taxpayer right to know and a number of other key bills. Senator Ossoff.
Thank you, Madam Chair, and thank you for all of your work fighting abuse, waste, duplication in the federal government. I'm appreciative. Comptroller General, nice to see you. Appreciate your dogged, determined, and independent-minded approach to your job. You're a great asset to the Congress and the taxpayer. I'm going to expand the scope of this discussion a bit into some recent work that GAO has undertaken with a particular focus on the opioid crisis and its impact on families and communities in the state of Georgia, and on consumer product safety for families with babies and young children. Just to set the table, in brief, what kind of follow-up does GA do to assess whether or not agencies to whom you make recommendations for change or reform are indeed undertaking such change and reform?
Yeah, we have a regular recommendation follow-up process, Senator. At a minimum, every 6 months, we check in with the agencies and we report on that. For this overlap and duplication work we do, for example, every year we follow up and we issue we have a public called Action Tracker that says what the agencies have done, what they yet need to do. So it's a very rigorous process for follow-up. And when I also send a letter each year to every agency head across the federal government listing priority open GAO recommendations that they haven't yet implemented to try to get them to move in that area. And then lastly, where we see the agencies not being responsive in a timely manner, or not at all, we'll work with the Congress to try to get the Congress to require the agencies to implement our recommendations. Regularly, every year, appropriation bills have many provisions requiring agencies to implement GAO's recommendations.
I appreciate that. And the crisis of opioid addiction, abuse, and overdose has impacted Georgia as it has every state. Georgia Department of Health says that all drug overdose deaths in Georgia increased by 55% from 2019 to 21. And to help address this problem last year, Senator Grassley and I introduced and the Senate passed our Rural Opioid Abuse Prevention Act. GAO undertook work June of 2022 report with recommendations to DOJ and DEA about developing guidance for registered drug distributors meant to help ensure the availability of medicine for legitimate use while limiting the availability of dangerous opioids for abuse and for diversion to illegal markets. So what I'd like to do is ask for you to affirm, as I'm pressing every relevant agency in the federal government to intensify their work to reduce the destruction wreaked by opioid abuse across the country, ask for you to affirm that you are continuing to monitor DOJ and DEA's progress in implementing those recommendations, and ask you for a commitment and indeed an affirmation that you will, as you typically do, report to my office, this committee, and the Congress with the progress that you're making to help save lives on this issue.
Absolutely, Senator. You have my commitment on that. There's proposed regulations out to deal with implementing our recommendations on the suspicious reporting and to put more guidance out to the agencies to codify the legal requirements for providers, as well as to provide additional guidance to them on how to report suspicious ordering activities as well. And my understanding is from my team is that guidance is due to be a final regulation next month. So we're monitoring those two recommendations we have for Department of Justice and DEA as well. Now, I might also point out, Senator, that I've designated drug misuse as a high-risk area across the entire federal government. And we have a number of recommendations open. We're happy to brief your staff on that high-risk designation. In fact, yesterday I talked to Dr. Rahul Gupta about the national strategy. I put it on the list because we didn't have a national strategy. There really wasn't good coordination among federal agencies, let alone at federal, state, and local level, with law enforcement, healthcare providers, people in treatment options, and others. So I'm very concerned about this issue. I share your concern about it, and you have my commitment that we will do everything we can to ensure our recommendations are implemented and that we can effectively keep you apprised of those efforts.
I appreciate that commitment, and I want next to discuss something that I know is top of mind for every parent in Georgia. And as the father of a 6-month-old baby daughter, something that I can relate to intensely, which is the concern about the safety of the products that families buy, whether it's strollers or cribs, that are under the regulatory purview of the Consumer Product Safety Commission. And that concern that a product malfunction or an error in manufacturing could lead to the death or serious injury of an infant or a young child. It's every parent's worst nightmare. In recent years, the CPSC has obtained the recall of certain products that pose risks to maternal and infant health. You issued, or the GAO issued in November 2020, several recommendations for the Consumer Product Safety Commission in terms of the management of case processing, investigative timelines, and how it measures the effectiveness of its recalls. How can we help make the CPSC system as timely and efficient and effective as possible at ensuring that no parent has to suffer the loss of an infant baby or a young child because of a preventable defect in a product that never should have hit markets or should have been recalled once it did? And will you commit to the people of Georgia and to my office, this committee, and the Congress that you'll follow up with us on the progress of the implementation of those recommendations, please?
Yeah, absolutely. You have my commitment on that. I'm a grandparent of 7 grandchildren, so I share your concern about this. There's nothing more worrisome than the harm that can occur to an infant or others. We also have an open recommendation to Congress here to create an entity that can ensure effective coordination across the government, solve jurisdictional issues between areas. Also, a high-risk area we have, senators, on food safety. Our food safety system's fragmented, and so we'll brief your staff on those issues as well.
Thank you. Georgia parents will be relieved by that commitment, and I look forward to continuing to work with you. Thanks for your testimony.
Same here, Senator. Thank you.
Thank you, Senator Ossoff. Mr. Dodaro, I'm going to submit a number of questions for the record and look forward to continuing to work with you and your team on some of the issues raised by those questions. But I did want to ask a question about IRS reforms and then just give you a chance to wrap up. I think that we have everybody who is planning to ask questions has already asked. So let me just start with a question about the IRS. Last week, I urged Treasury Secretary Yellen to do more to address the tax return processing backlog. In particular, the backlog has been fueled by the fact that IRS requires amended tax returns to be filed on paper. In the 2019 duplication report, GAO recommended that Congress authorize IRS to add a scannable barcode to forms filled out on a computer but submitted on paper. This would allow IRS to process returns more quickly and reduce data input errors, which could save millions of dollars every year. My legislation with Ranking Member Paul would give IRS this authority, and I'll continue to urge my colleagues to consider taking up this common sense reform. Before we conclude today, can you briefly discuss the impact that this particular reform would have on resolving the tax return backlog?
Yes, I'll ask Jessica Lucas-Judy to elaborate on my answer, but the short answer is that by scanning it, it quickly gets it into digital form.
Right.
You eliminate manual entry. IRS has already demonstrated there's a good return on investment from saving the labor costs, but more importantly, and Jessica will explain how it could be helpful in further enhancing IRS objectives and Congress's objectives for enforcing our tax laws and processing returns faster.
Thank you.
Yes, absolutely. It would help both with eliminating or reducing the backlog as far as being able to process returns faster, thereby also potentially reducing the amount of interest that IRS has to pay on refunds that are overdue. It would also help to prevent and better detect identity theft refund fraud. With IRS, it would be able to get that information from the paper tax returns into the returns processing system to be able to detect the identity theft and also help with compliance efforts as well. So we definitely appreciate your introducing that legislation. This is something that we've been recommending that IRS pursue since, I think, at least 2011 was when we first brought it up. Okay. So we definitely would welcome that.
Well, I appreciate that very much. Concerns about the time that tax refunds are taking is probably one of the top issues I'm hearing about from constituents just on a steady basis. And obviously for some people, this is a matter of financial stability all the way around. So I thank you for your work on that, and we'll keep pushing. Mr. Dodaro, to wrap up our discussion today, why is it important that Congress address the recommendation we just talked about, as well as GAO's other open recommendations?
Well, we all want a more effective, efficient federal government operating on the best interests of the American people. And GAO's recommendations are all designed to do that, to make government more efficient by saving money, enhancing revenue collections to the government in order to deal with these issues. Our track record's very clear. Beside the overlap and duplication work that we do, we have other recommendations that are implemented. And in the last 5 years, we've averaged $158 back to the American people for every $1 invested in GAO. Great. It's a good return on the investment, but beyond the financial benefits to the government, it improves public health and safety issues, as we've discussed today, and it makes government operate in the better interest of the American people. And so these are all things we're dedicated to at GAO, is to make sure our government works for the American people. It's accountable. Its performance is what it should be to deal with these issues. And where it isn't, that's our job to point that out and to deal with these gaps. And it puts government in a better position to deal with national emergencies. For example, in 2015, we made a recommendation that there ought to be a national aviation preparedness program for communicable diseases. Mm-hmm. That was not acted upon. So here we were 5 years later in 2020 in a pandemic with no plan. There still isn't a plan. I'm trying to get that implemented as well. So their GAO recommendations, a lot of people think of us as just, looking out for reducing funding, and savings and dollars. We're not all about dollars. We're about public health and safety. We're about a better, well-performing, functioning government to protect our country from national defense to health care across the full spectrum of federal government's activities and operations. We're committed to do that. Congress does act. Over 76% of our recommendations are acted upon by the executive branch and the Congress on a regular basis. and we're committed to continuing to work to get full implementation of our recommendations, as I know you are. So thank you very much.
Well, I appreciate that. I appreciate the work of you and everybody at GAO for exactly this reason. As one of my mentors once said, remember, never let the urgent crowd out the important. And I think that that's one of the things that you all really focus on, is what's important and what do we need to do short-term and long-term to make this government more effective, both in terms of function and in terms of cost. So in closing, I would again like to thank you, Mr. Dodaro, and the other Government Accountability Office analysts that joined us today for their time, for their testimony, and for the important work that you all do for the American people. And I'd like to reiterate that I look forward to continuing to work with Ranking Member Paul and others to save taxpayer dollars and deliver government services more efficiently and effectively. The hearing record will remain open for 15 days until 5 p.m. on June 29th for submissions of statements and questions for the record, and this hearing is adjourned.